We're getting more and more patients because, frankly, we're having amazing success. The ADHD is resolving, ADHD conditions, mild dementia conditions, people coming in with pain, neuropathy, very, very bad physical pain, and the pain is going away too. Within a couple weeks, alert and oriented times 3, back, approaching previous levels of functioning, which was very, very high and is very, very high at this point in time with the treatment. And again, no side effects whatsoever. It's really a one and done, unlike medications where you have to keep taking the medication. Hello, this is Dr. David Lopez back with you. I haven't been on in a while because we've been really busy at the office. And so at the prodding of my creative team, I'm getting back online now. And I just want to discuss a little bit of the reason we've been so busy, and the reason we've been away is because we've actually been treating patients. And specifically, we've been treating patients with our TMS service, Transcranial Magnetic Stimulation service, and we've been having amazing results. So we've been really busy treating patients, and we're getting great results. And again, as a nod to the creative team, it is time to get back online and get the message out because, as I mentioned before, I've been doing this for about 30 years, being a psychiatrist in the field of mental health. Just a quick background, since I haven't been on recently. I am a physician. I'm an MD, went to medical school and all that fun stuff. And then I did my residency in psychiatry. So I deal with mental health issues, conditions such as mood disorders like depression, anxiety, PTSD, and then thought disorders, things like schizophrenia, chronic thought disorders, psychosis, cognitive impairments, ADHD, and then, of course, substance use disorders, alcoholism, cannabis dependence, opiate dependence, all those types of disorders, gambling, impulse control in general, smoking cessation. So we help people along those spectrum. And for the longest time, we've been using prescription medications primarily. And that's really what we did. I've done inpatient, outpatient, but the brunt of the service offerings have been through prescription medications, antidepressant, anti-anxiety agents, stimulants, antipsychotic medications, mood stabilizers, so on and so forth. But over the past year and a half, we've started using this new kind of treatment called Transcranial Magnetic Stimulation, or TMS for short. And it involves, it's non-interventional, okay? So you're not putting a pill or getting a shot or putting a chemical into your body. And it's not like the old days when people would do electroconvulsive therapy where you'd put a direct electrical current into an individual in an operating room setting to induce a seizure. It's much different than that. It's not surgery either. And there's no radiation involved, which is so cool as well. But it involves electromagnetic energy. So electromagnetism. And what we're doing is we're using electromagnetic energy to reset the electrical activity of the brain. So the brain, the human brain, individuals can function much better. So their depression goes away, their anxiety goes away, they think more clearly. And I got to tell you, as I said at the beginning, we've been busy treating patients. We're getting more and more patients because, frankly, we're having amazing success. Again, I've been doing this for 30 years, and I haven't seen anything like this. People just get better with this treatment, TMS. They get across the board, people are getting positive benefits, very positive benefits. And I can tell you for depression and anxiety, it's been great. So we get people coming in with mood disorders, mood instability as well, and their mood is getting stable. Their mood is getting better. Their anxiety is decreasing. We're getting people coming in for problems with focus and concentration. Also, problems with mild cognitive impairment. So people are having mild dementias and coming in and getting treated, and those conditions are resolving. So the ADHD is resolving, ADHD conditions, mild dementia conditions, people coming in with pain, neuropathy, very, very bad physical pain, and the pain is going away too. So it's incredible in that regard. It's actually something that we really didn't anticipate at the beginning when we started treating patients, how effective it is for physical pain. Neuropathic pain is getting better with this TMS treatment modality. I can give you some cases at a high level, starting with the pain. Elderly lady, late 80s, having a hard time standing up straight, in severe pain, hip, lower extremity, shoulders, cognitively pretty sharp, but just not feeling good because of the severity of the pain. Started treatment within 2 weeks. She's standing up straight. Her gait is steady, stations normal. The pain is probably 90% gone. The mood is much better. The cognition's sharper, although, again, that wasn't an issue. Had another gentleman, late 70s, came in, literally could not tell us the day of the week, what month, even what city they were in, and started treatment, and within a couple weeks, alert and oriented times 3, back, approaching previous levels of functioning, which was very, very high and is very, very high at this point in time with the treatment. And again, no side effects whatsoever. That's on the thought side. Another young lady, late 20s, on antidepressants and stimulants, having a hard time after an accident. So also some physical pain, but not as prominent. It was more for mood and focus and concentration. Started the treatment, completed the treatment, not needing stimulant medications for ADHD, not needing antidepressant medications anymore, and fully functioning and functioning in a very happy way, and much more active and less isolative. Another young male, late 20s, non-functional over the past few years with increased depression and anxiety, OCD as well, and started treatment. Mid-treatment right now, still advancing, but the gains have been phenomenal. Family is very pleased. The patient himself is very pleased. His depression's pretty much resolved. Anxiety is receding. Less isolative, wanting to get back in the workforce. Pretty transformational. Again, no side effects. And these are just some of the patients that are coming off the top of my head. There's other patients, but you get the point, I hope, is that this is a really good treatment option for people. And again, the young man's not needing medications. He was now wanted to take meds, but had tried meds, and none of them had really worked or gotten bad side effects. And so, again, very effective from a non-medication standpoint, or the prospect of not needing medications, but feeling really good. I think there's been some questions, I understand, since I was last on about some of perhaps my earlier videos and some of the feedback that we got. And so I wanted to answer those questions. And I think the first one was, how long are the TMS sessions and how frequently are they scheduled? And so to answer that question, there's different types of protocols out there. As I, said initially, we're not the only place in the country that's performed these services, nor are we the only place in Northeast Ohio, I would wager, is performing these services. So everyone's going to have different ways that they deliver the treatment. But for us right now, we're usually booking 1 hour a day, 5 days a week for about 7 weeks, 35, 36 sessions. Each session is booked for an hour, but the actual treatment itself is 20 minutes each session. But, when patients come in, we have to get vitals and ask questions, make sure they haven't been doing anything that would be counterproductive for the treatment. So we ask that people don't use any alcohol, use any cannabis or illegal substances while they're going through the treatment. We ask them to refrain from any caffeine for a couple hours before the treatment, although they can use caffeine afterwards. Things like that. We get the vitals, make sure everything's medically stable. And then we perform the treatment, which is about 20 minutes. It's like working out the brain. Like if you go to the gym physically, you'll warm up, and then you work out really vigorously and then have a warm down. And that's what we do after the 20 minutes of the TMS session. We have a little bit of a warm down, make sure everything's okay. And then the patient can go about their business. So typically it's 5 days a week, 1 hour a day, for about 7 weeks. And then after that, it's pretty much you're done. Some people may need occasional boosters, but nothing with the frequency and the length of treatment that I just described. What we're seeing is the patients who have completed our program are going about their business and not needing to come back and get any further treatment. So it's really a one and done, unlike medications where you have to keep taking the medications. If you stop, a lot of times the symptoms will come back. And so this is another thing that's really attractive, I believe, and positive about transcranial magnetic stimulation, or TMS. So that's really cool. Another question that we got, let me see here, because they handed me some questions. Is TMS painful? That's another one that, and what are side effects, potential side effects and sensations? I would say TMS is not painful according to what I've been experiencing and seeing with the patients that are undergoing TMS. What some people will describe is they get a mild tapping sensation from the magnetic pulses, from the magnetic coil when the pulses are being emitted towards the scalp and the cranium and the brain. And then as we, pick up the intensity, the tapping may feel, more, you just may feel it more. But I haven't heard anyone say it's painful. And then, of course, if it did become painful, we would decrease the intensity of the pulses being emitted. Sometimes after the session, we've had occasional complaints of headache, even migraines, some sensitivity to light. We had the patient put on sunglasses. You can take some Advil, but that is usually resolved. It has not been a deal breaking in the sense that no one has stopped getting treatment. I think maybe we've taken a day off with one patient, if I can recall, but they got back into it and we're doing good. And then overall sensations as people are getting the treatment, they talk about how they feel like, quote, a fog has lifted, end quotes, from their brain. So that would be referring more probably to cognition, that they're just feeling so much more clear-minded and able to think clear. So a fog is lifted. Some patients have described more vivid colors, like colors look much more vivid to them as they're going through the treatment, especially initially. And then, of course, the mood is better. They feel more calm, more relaxed. Other questions that have been, do you need to take time off from work, school for TMS treatment? No, not really. We just will work around your schedule. If you want to take time off, that's really up to the patient. But as long as you're able to get an hour in a day, 5 days a week for 7 weeks, you make that commitment. You can work around the schedule and we'll work around your schedule. That usually takes care of itself. What happens during the TMS evaluation process? Well, we're going to sit down with you, myself, or one of my colleagues. We're going to do a full psychiatric consultation, initial psychiatric workup, and make sure that TMS is right for you, right? We're not going to provide this treatment unless you're qualified unless you meet the criterion. And there are certain things that, we have to make sure that, you're cleared for. So, there's certain things such as like we don't want metal, in the cranium. We don't want cochlear ear implants. History of seizures can potentially disqualify, depending on the history of the seizures. If there's cardiac conditions, we also want to make sure that we fully understand that other neurological conditions besides seizures need to be addressed. So basically, we're doing a full workup. We'll do blood work if indicated, if needed. We definitely don't want people using alcohol, cannabis products, legal substances, obviously like opiates, off-label benzos, cocaine, meth, PCP, psychedelics, those kinds of things. Any of that stuff for us would be a non-starter. We'd want you to we'd want patients not to be using if they were going to start going through the treatment process, because, of course, those kinds of things, something like alcohol would lower your seizure threshold, and then we're, developing, we're using magnetic impulses, towards the brain. We don't, we have to minimize risks on them. We're very precise in how we treat each patient. We take the care of the patient very, very seriously, and we're very, very precise in how we map out and measure each individual, each patient's brain, and where we're targeting the magnetic impulses. So although they're painless and although they're very effective, our machine is very, very high tech, and it is extremely precise, and we do not want to be, just firing off magnetic impulses willy-nilly at different parts of the brain. So we have to be very, very diligent and cautious about that. And then also we ask the patients to take responsibility so that they're staying sober and away from bad habits that actually can cause mood disorders and thought disorders. But I dare say that getting the TMS, one of the big things that we see, so people who have substance use disorders, their cravings actually disappear. So people lose the cravings to use alcohol, smoke cannabis, use cocaine, meth, psychedelics, benzos, any of the drugs of abuse. We're seeing very, very positive results with people who've had substance use disorders. That's not really something I've talked about, but there's a lot of research going on in this area, and we're seeing it as well, boots on the ground, actually, as treating providers. We're seeing success in terms of impulse control, so smoking cessation, even gambling disorders. One of the cool things I'm actually planning on going to a seminar next week where other providers across the country are gathering to find out what the best practices are right now in the field of TMS. It's not something that a lot of people really are aware of yet. No insurances are really covering this. Unfortunately, I think it should be something that should be covered because it's such an effective treatment. But I think it's so new that no insurances are really covering it. And I got to tell you, a lot of docs in my field, even other psychiatrists, but certainly in other fields like cardiology and medicine, people aren't even aware that this is available as a treatment option for patients. So it's something we're going to try and get the word out, and I'm really looking forward to going to meet with some of my colleagues in the medical field, particular psychiatry and mental health, to see what their experiences are with the TMS from across the country and probably across the world. I think it's going to be, there'll be people internationally coming in too. So I will look forward to coming back online and sharing that information that I get with interested parties who are watching this video and want to learn more about TMS. So also other questions, let's see here. Is TMS a permanent cure for depression, OCD, or PTSD? Well, right now the field is so new. I would say it's still a little subjective. The jury is still out, but again, from my experience, what I'm seeing is that once patients get the treatment, say for depression or OCD, we're not seeing patients needing to come back. So, like sometimes people take medication, they take an antidepressant medication, and it works for them, but then they stop taking it for whatever reason. They feel good, they don't feel they need it, but the depression starts to come back. And then they got to start taking the medication. And sometimes when they restart, the medication doesn't work that good like it did the first time around. So that's really a risk with medication. With TMS, I think it's a little different so far. And again, this is subjective, but what I'm seeing is that what we're seeing is when the patients get the treatment and complete the course, they're not really needing to come back. Now, I will say there's a caveat. Now, I've talked to some other people that don't do the sessions for the same duration that we do. We're doing 35, 36 sessions over the course of 7 weeks. I see other providers doing sessions maybe for 20 sessions. And again, the patients feel real good, but I feel like the neural circuitry has not been adequately treated and fortified with only 20 sessions. I think it's, all of our patients have been doing really good at 20 sessions, but we keep on forging and blasting through with the treatments to get to the 36. So we're really pushing through and encouraging our patients to complete the 36. And I think that once you get to session 20, yeah, you feel pretty good, but if you stop, the neural circuitry hasn't been permanently changed in a positive way. So you run the risk of perhaps some relapse or recidivism going back into whatever you're being treated for, pain, depression, mood, thought disorders. Whereas when you do the next 16 sessions, 20 to 30 and 30 to 36, you're really fortifying the initial changes that you got over the first 20 sessions. So there is some discussion about what is the best number of sessions to get. So maybe that's some information I'll have when I come back from this seminar that I'm going to next week. So, okay, a couple more questions. Uh, TMS versus medication, what's the difference? Okay, so we'll recap. There's certain ways to treat mental health disorder. I think one would be surgery, like neurosurgeons. You're doing a direct physical intervention into the central nervous system or the nervous system in general. Then you have chemical intervention, which involves pills, okay, medications. You're taking a pill, getting a shot, getting an IV, and there's a chemical intervention with the pill, and it alters the chemistry of our brain. Our brain chemistry changes with medication. There's a third, which is direct electrical intervention, electroconvulsive therapy, which I mean, in the old days and even to this day is done where people are taken into an operating, OR under controlled circumstances, done very safely, but they have a direct electrical current put into their body, induces a seizure, and by doing that, that actually helps helps them come out of a depression or a psychosis. It is, I mean, people would say somewhat primitive. It has its risks. I mean, your memory impairment can break bones, but it is, I will say, effective. I've never really been a big proponent of it because of the side effects, but I do recognize its efficacy in the field of psychiatry. So I would say it's a legitimate treatment option, electrical intervention. So far we have physical, chemical, electrical. And what is TMS? TMS is an electromagnetic intervention. Okay, so we're using electromagnetism to alter the brain or reset the brain's electrical activity, because it's a basic law of physics. When a magnetic field is generated, the magnetic wave, when it reaches a solid, something solid like solid wood or tissue or metal, the magnetic field gets converted to electrical current, and we're actually altering the electrical activity of the brain without doing ECT, and in so doing, I would say we're doing it in a very safe fashion, And again, no radiation is involved, and it's non-interventional. So these are the four ways that we can affect a human brain to help with mood or thought disorders. There's a surgical or physical intervention, there's chemical intervention, there's electrical intervention, and there's electromagnetic intervention, which is the newest iteration of mental health treatment, and that's what we're doing with TMS or transcranial magnetic stimulation. So I think, let's see, that might be it. Maybe we could answer one more question before we go. Who is a good candidate for TMS therapy? I'll tell you, with what I've been doing lately, I don't think almost anyone's a good candidate for TMS therapy. I almost want to say that this is such a new field. I mean, it's really only been going mainstream over the past 5 years, but with the success that we've been seeing, the benefits that the patient's been having for the different types of conditions, I think, pretty much you could think about if you have mood issues, if you have thought issues, you have physical pain issues, sleep issues, substance use disorder issues, any of those types of things, you're going to be a good candidate. And I know this is really early in the field of TMS, but I would also say that I almost think before long, I mean, everything that we use a pill for to treat uh, physical health conditions and mental health conditions, there might be a protocol from a TMS standpoint to help treat these different types of conditions. So it's very exciting, the field that we're in right now. And I am so pleased and gratified that our patients are getting better. And I really am glad that I was able to get online this afternoon because, like I said, we've been super busy. And I'm so happy we've been able to get online this afternoon and share some of this information. I hope this is helpful for everyone who's watching it or who chooses to watch it. And if you have any questions, you can please log on to our website at psychiatrynetworks.com, www.psychiatrynetworks.com, and you can give us a call. Our number is there as well as like 216-341-0070, 216-341-0070. And we'll be able to help you and give you good information on TMS and what we're doing. So thank you very much for listening. I'm going to be back again with more information and more answers to questions that viewers may have. So if you do have questions, please feel free to send those in. And then I know they always say just like us. I don't know where you like us, but please feel free to like us if there is a way to like us, because I think that, again, will help our creative team feel good about what they're doing because they're working really hard to help us get the word out about TMS. Okay. So this is Dr. David Lopez, staff psychiatrist from Psychiatry Networks, sharing this information with you and signing off. And I hope you all have a good rest of the day. Thanks. Bye-bye.